Hello everyone, this is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing a relatively rare condition, albeit a condition which confuses many clinicians, and dorsolateral wrist pain. It is known as Wartenburg's syndrome or Wartenburg's disease, or otherwise known as pteralgia peristatica. This is entrapment of the superficial branch of the radial nerve as it goes between the brachioradialis and the extensor carpi radialis longus, which is one of the two muscles that makes up the second dorsal wrist compartment. How do we diagnose this condition accurately to have an accurate human movement diagnosis? You could do upper limb neurodynamic testing of the radial nerve. I can pronate the forearm, flex the wrist, and ulnarly deviate the wrist in an attempt to put tension on the superficial branch of the radial nerve. This test does sometimes take up to a minute for symptoms to appear, particularly if the patient has intermittent symptoms or they are asymptomatic upon clinical examination. You can also tap along the superficial branch of the radial nerve to reproduce the pain, burning, or paresthesias into the dorsolateral wrist and or dorsolateral web space. How do we treat this condition? We treat this condition by mobilizing the brachialis if this is indeed a repetitive overuse situation. However, if it's a condition where something's been pressing on it, we need to relieve that pressure, give it a couple weeks, and then start radial nerve glides. So I can use the gorilla arm radial nerve glide, starting dose 20 to 30 repetitions, 2 to 3 sets, twice a day. If this doesn't do it, I might have to get some blood to the superficial branch of the radial nerve where the brachioradialis is, or the extensor carpi radialis longus lives. I might have to mobilize brachioradialis, which you can see in a previous video. I might even have to do Mills stretch to help release any tension or tightness that's causing the potential entrapment. And our last cause is a blunt trauma. Maybe I was playing baseball with my friends and we were fooling around and the ball bat mashed the superficial branch of the radial nerve. In this case, we usually want to do protection of the nerve and maybe resting of the nerve and or splinting before we do any exercise. For those who might have chronic symptom post the trauma, then we would do superficial radial nerve glides and or muscle mobilization to treat any chronic lingering symptom post-trauma. If you've liked our Wartenburg syndrome or Wartenburg disease video, please share it with your friends, family, patients, and colleagues, especially if you're an elbow, wrist, or hand clinician. Take care and see you all again soon.